Hello friends, welcome to the channel Dewdear Academy. Today I am discussing the topic Addisons disease. I am discussing NCLEX RN questions related to this topic Addisons disease. So the question here is, the nurse should assess a client with Addisons disease for which of the following? Options are weight gain, hunger, lethargy and muscle spasm. The nurse should assess a client with Addisons disease for which of the following? Options weight gain, hunger, lethargy, muscle spasms. So here we should know what is Addison's disease and the clinical manifestations. Then only you will be able to answer this type of question. So what is Addison's disease? Addison's disease means hyposecretion of adrenal cortical hormones. Hyposecretion of adrenal cortex hormones. So which are these adrenal cortex hormones? They are mineralocorticoids. First one is mineralocorticoids. Then second is glucocorticoids. Glucocorticoids. And the third one is gonadocorticoids. Gonadocorticoids. So these mineralocorticoids mainly it include aldosterone. Then glucocorticoids that include mainly this cortisol, and androgens are mainly included in this gonadocorticoids. So what is this action of this aldosterone? Aldosterone helps to maintain water and electrolyte balance in the body. It helps to maintain water and electrolyte balance. It is through sodium and water retention. It is mainly helping through sodium and water retention, and there will be excretion of potassium. And thus it is helping to regulate BP. It helps to regulate BP in our body through these mechanisms, that is through sodium and water retention in our body and excretion of potassium. So what happens in Addison's disease? This is a normal function of this hormone aldosterone. This sodium and water retention, and thus it helps to regulate the water and electrolyte balance in our body. But what happens in Addison's disease? This function is decreased. There will be sodium loss in urine. Okay, there is sodium loss in urine, and there will be loss of extracellular fluid, and that is leading to hypotension. So that is the features in Addison's disease. So the clinical manifestations, with this we can identify the clinical manifestations. There will be low BP, then there will be low sodium, hyponatremia. There will be low BP, then low sodium. Then again this glucocorticoids or cortisol is the another adrenal cortical hormone, and mainly cortisol. And what is the function of this hormone? Glucocorticoids, it is helping to maintain or regulate the carbohydrate metabolism. This cortisol helps to regulate the carbohydrate metabolism in our body normally. That is the function. So that is leading to hyperglycemia. This is a normal function of this glucocorticoids or cortisol. It is helping the carbohydrate metabolism. In Addison's disease, what happens? In Addison's disease, this function is reduced, so there will be hypoglycemia. And also you should know that here there is metabolism, there will be increased metabolism, so the body temperature is also increasing. In our body, normally the body temperature is increasing due to this function of this glucocorticosteroids. But in Addison's disease, there will be decreased carbohydrate metabolism leading to hypoglycemia. And as the metabolism is reduced, the temperature, body temperature is decreasing here. So with these functions, we can understand there will be low temperature. There will be low temperature, and also there is low glucose level in our body, low glucose. And there will be low energy leading to fatigue. The patient will be having low energy. Then we can see the next hormone, that is gonadocorticoids or androgens. These hormones are also getting decreased in the Addison's disease. There are three adrenal cortex hormones: mineralocorticoids, glucocorticoids, and gonadocorticoids. So in gonadocorticoids, or we can call androgens, mainly these androgens, what happens if there is, it is mainly needed to control the development of the secondary sexual characters in secondary sexual characteristics. It is mainly important to maintain the secondary sexual characteristics in body. So what happens if there is, in Addison's disease, again these hormones will be reduced, so there will be loss of body hair, and also there will be diminished sex drive. So these are the features associated with decreased gonadocorticosteroids in Addison's disease. So there will be low hair, or we'll call it as alopecia. Alopecia will be there. Then low periods or amenorrhea, slow or absent periods. So amenorrhea can be noted here. And other features, mainly the associated other features, there will be low weight loss will be found, low weight. Then appetite will be reduced, so low appetite. The patient will be not having hunger. And muscles become weak, low muscles become weak here, but it is not getting spastic, it is just getting weak. Okay, weak muscles. So these are all the manifestations which we can see in this condition, Addison's disease. Addison's disease is caused due to the deficiency of all these hormones. So in these options, what is the clinical manifestation? The nurse should assess a client with Addison's disease for which of the following? So which is the clinical manifestation which is significant with Addison's disease? If the patient is having weight gain, no. In Addison's disease, everything is considered, mainly these all areas are low here. Okay, Addison's disease, the weight gain also we can see here, low weight. So weight gain is not there, weight loss is found. So this is not the answer, this is wrong. Then hunger, the patient will be having low appetite. So the patient is not having hunger. So not hungry, the patient is not hungry here, so hunger is not the answer. Then there will be low energy and the patient will be having fatigue. So lethargy is applicable here. Then muscle spasm, low muscles, here we have mentioned low muscles, but it is not spastic, it is weak muscles. Muscles are just weak, but it is not spastic. Okay, weak muscles are there, it's not spasm. Okay, so that is also wrong. So here the correct answer is option C, lethargy. The nurse should assess a client with Addison's disease for which of the following? Weight gain is not correct, hunger is not correct, but the patient will be having low energy, that is lethargy, and muscle spasm, that is also not correct. So correct answer is option C, lethargy. Then in Addison's disease, most of the clinical manifestations are found low, but there are some highs also. Some manifestations are found high, mainly their potassium. The potassium will be high. First, potassium will be high because we know that in mineralocorticosteroids, mainly it is helping the sodium and water retention and potassium excretion. But in Addison's disease, there will be sodium loss and there will be a retention of this potassium. So potassium will be high. Potassium is found high here. Then again we can found there will be another P, that is pigmentation. That is bronze pigmentation is an important manifestation. Bronze pigmentation is important manifestation in Addison's disease. There will be darkening of skin in Addison's disease. That is why it is known as bronze pigmentation. It is due to the melanocyte stimulating hormone which is produced in response to increased adrenocorticotropic hormone. As there is increased in Addison's disease, as there is low adrenal cortex hormone that will stimulate the pituitary to produce more adrenocorticotropic hormone. So in response to increased adrenocorticotropic hormone, there will be stimulation of melanocyte stimulating hormone. Melanocyte stimulating hormone. So that will be leading to increased pigmentation. Then another P here is peaked T waves. So one of the manifestations, ECG manifestation, is peaked T waves and ST elevation. There will be peaked T waves and ST elevation, ST segment elevation. So there are 3 P's which are found high. High or elevated 3 P's are there. One is potassium will be high. Then there will be bronze pigmentation that will be high. That is due to the melanocyte stimulating hormone which is produced in response to adrenocorticotropic hormone. And also there will be peaked T waves and ST segment elevation. So these are the manifestations in Addison's disease. I hope this is clear to you. So thank you.